I had the chance to speak to Dr. Kanakarajan, who's the lead clinician at NHS Grampian's pain clinic and is based in Aberdeen. We used the Near Me system, which health boards throughout Scotland are using to have virtual consultations with their patients. Although this system has been available for some time, it is only since the COVID crisis that it has been rolled out throughout all health centres and hospitals in Scotland. Chronic pain sufferers have struggled for years trying to get to GPs and clinicians for consultations, so it is vital that this system continues to be used even when the COVID crisis is over. So, what's it like to use the Near Me system?
I think this is a very good technology, and it will definitely be very useful for chronic pain patients. In fact, we started introducing this technology in our clinic in last October itself, but there were not many uptake. Yeah, so but with the pandemic, okay, because of the necessity, people are kind of happy to accept this type of appointments, and they are very pleasantly surprised how convenient it is, how easy it is. With the video call, you still have the rapport with the patient. And we always have the advantage of getting people back to the clinic, okay, if there is a need for physical examination.
It was great to hear that the pain team are so keen to use up to date technology to help their patients. But what of their future plans?
The technology is here to stay, and in fact, what we are trying to do is we are trying to find out whether we can get an app. Yeah, so in that way, even before coming to the clinic, okay, whether the patients can fill in some of the information, so that we kind of make a judgment call whether whether things can be done in the primary care itself, or how can we direct it to the whether they're the best seen by the nurse first, best seen by the physio first, best seen by the consultant first, or directly go to the injections. So that type of thing is coming up. Okay, and in that way, say for example, if we had a treatment, then it will be follow up. It will be, we can easily use the technology, use the app. Okay, how am I doing? Okay, this medication is doing good, bad, and those kind of information, and we can process in behind the screens and get in touch. So those type of developments are coming up.
I asked him about the staff makeup at Aberdeen Pain Clinic, and he confirmed all the staff there are part time, just like the other health boards in Scotland. I don't think it's well known that there are actually no full time consultants in pain services in Scotland. I also asked him if the Elgin Pain Clinic would be expanded to have a full multidisciplinary team, as promised in the Public Health Minister's letter to me, and how an increase in staff would help with the huge backlog of patients.
The staff makeup is, you probably know that we are how many consultants? 4 consultants, and all of them are part-time, and we do have 3 physiotherapists now. Yeah, because this is an increase. I think the increase came only this month, not this month, this year. Yeah, initially had only 4 sessions of a physiotherapist. That's what we had, nothing more. Okay, but that has been increased. And well, we did not have psychology for a long time, and then we had only 3 sessions of psychologists, and they also quit the job, and we were literally without any psychologist. Now we have got 3 psychologists. Yeah, so that is again, it's from this January. Okay, and in fact, the third psychologist has not joined yet. So the one of the plans is to start a pain management program in Elgin. So that will be staffed by a psychologist and a physiotherapist. Yeah. So yes, there are plans, but with the new normal, I do not know how things are going to be, because we our team, the team has been very enthusiastic, in adapting the innovations and adapting the technology, and we have started doing online pain management programs like this video consultations. So that means then the site may not matter. It is too early for me to definitely comment, yes, it is going to be there. But with the such an increase in the staff, I would have expected things to be there in Elgin. I think we still need a bit more nursing staff because we have got only one nurse, okay, and if we have more nursing staff, then there can be easing of pressure on the review appointments. So we have asked for that as well, but again, it's a classical case, isn't it? On a weekly basis, we kind of ring up patients and ask whether they are quite happy to come to this video consultation, and if they are happy, then we are giving them the video consultations. Yeah, that is what we are doing, which is in some ways is helping us to address the backlog. Yeah, but it is nowhere near going to sort the whole thing out.
I moved on to the subject of appointments. Some members state they are not given any choice of where they are seen. I asked Dr. Kanakarajan if the outpatient admin staff have been given instructions to book the patient into the clinic nearest them, i.e. Elgin or Aberdeen, and if they had the capacity to carry out both first-time and return appointments.
What I've been told by the outpatient department when they give the patient focused booking, or they ring up the patients and give them the choice, they do ask. That is what I have been told. Okay. And in this, I think, with the near me consultation, this type of consultations coming up, it will be much easier. In fact, what we did highlight it to the department, okay, or the people who are booking the appointments, we did highlight it to, even for this type of consultations, book it to the consultants who are visiting Elgin, for the people who are from Elgin, so that the care, if they need to be reviewed, they can be reviewed in Elgin rather than the needed to travel. So, because couple of my colleagues, they come to Elgin, but that is what we have given instructions on. When they are being given an appointment, okay, when they receive that phone call, they need to highlight it. Yeah, because if they highlight it, a person at the other end of the phone will definitely give you, because you do have the availability. I think it is probably wrong to say that we have got the capacity. Okay. Yeah. But I think it is fair to say that equal opportunities are given for both new and return. Okay. Classically, for every one new patient, it's about 1.75, review appointments.
There has been a lot of discussion this year at the Holyrood Cross-Party Group on chronic pain about infusions being withdrawn during the COVID crisis. This has meant that some patients have actually had to travel to England to get infusions done at a cost of about £1,000 a time. Although most health boards carried out infusions before COVID, NHS Grampian did not. I asked Dr. Kanakarajan when and why the infusions were stopped.
I do not know when it was stopped. Okay, I have been here for good, how many years? I came in 2007, so I don't recall many infusions happening since 2007. So it has been more than 15 years. Okay, it has been stopped. Yeah, yeah, yeah. So in fact, I think the specific infusion, what you are talking about is the lidocaine infusion. There is no much of significant evidence to that. Okay, because of the no significant evidence, we never reintroduced it. Currently, we do only one infusion, okay, called as the pomidronate infusion. Okay, that is, again, it is only one-off infusion recommended by the Royal College of Physicians for the people with CRPS, and it should be done within 6 months of the condition. So that is the evidence for it. Okay, so that is the only infusion what we do here.
One of the most contentious topics for chronic pain sufferers in the last couple of years is the difficulty in being prescribed opiates and then actually being allowed to stay on your prescribed dosage. We hear far too many reports of patients going to a pain clinic and then having their opiates stopped or reduced without any discussion. I wondered whether the withdrawal or reduction of opiates was done on a case-by-case basis or was a blanket policy decision. The reality, however, would seem to contradict his assurance that there is no blanket policy of forced opiate reduction or withdrawal.
It is purely done by case basis. It is not a policy decision. Okay, yeah. So it is about, there's quite a lot of things, which we have to take into account. Okay, so increasingly, but these kind of things which we did not know before, now opioids influence the adrenocortical function. On top, in the last few 3 to 4 years, we learned, or the scientific community has come out with how the opioids influence the adrenocortical function. So that is essentially do or die scenarios. So when you do those type of tests and find out that it is influencing you, then we have got a duty of care to advise to reduce it and stop it. Number one. Number two, what we have found is the higher the dose, there is not much significant improvement. People, people, if they are on a stable dose, then nobody is going to come and stop it on a stable dose. If it is not only giving them pain relief and giving them adequate ability to maintain the quality of life, we kind of, there is no blanket policy that no.
I think it's important that Affa Sair maintain a good working relationship with the team at NHS Grampian Pain Clinic. I want us to be able to ask the difficult questions as well, so that NHS Grampian has no reason not to include patients' views when looking at developing the pain services. So I asked Dr. Kanakarajan what can Affa Sair members do to help the team at the pain clinic just now.
One of the things which I was kind of thinking was, if any of the members had undergone this near me video consultation, and if they can feedback, what was their take phone. So what I find is nearly 40% of the population, 40% of the appointments, they opted for telephone. So that means there's a significant percentage of people out there who they are not tech savvy. Oh, and because of that, it will be useful for us to know what the patient's take is, because we do not want to just assume, okay, this is all going very well.